It's my feel-good breakfast show.
And earlier on, we heard about technology that's been invented to unboil an egg, but have you ever wondered what makes South Africans' blood boil? Well, these are things that include taxi drivers, people who curse, pop-up internet ads and paying taxes, because according to a study done by Pharma Dynamics, these are the top 30 frustrations that make South Africans see flames. But be careful because, of course, the daily annoyances can contribute to hypertension, which is responsible for 130 heart attacks and 240 strokes that occur locally in South Africa. Now, as we are in the midst of Heart Awareness Month, we welcome Pharma Dynamics spokesperson Mariska van Askewegen onto Expresso here to speak more about this silent killer, because it is something we need to be very, very aware of. Good to have you here.
Kat. Thanks, nice to be here.
Let's first start by identifying hypertension. Exactly what is it?
Hypertension in simple terms is high blood pressure, and it explains it's self-explanatory. We need pressure in our bodies and our veins to push the blood from our heart to our organs, which is obviously quite important. But when that pressure becomes high or is too high for a prolonged period of time, then it can cause damage to your organs. So it's very important to recognize if you have high blood pressure in order to treat the high blood pressure so you can prevent the damage to your other organs.
Yeah.
Yes.
So what are the signs and symptoms then?
Signs and symptoms, unfortunately, of depression, as you call it earlier, a silent killer. So you don't always know that your blood pressure is too high.
Sure.
And that's the dangers with this disease, is that so many people are undiagnosed and don't know that they do have high blood pressure. So it's quite important for you to have regular checkups with your doctor and make sure that they do test your blood pressure.
Now, the survey that Pharma Dynamics conducted included 1,300 South Africans to find out what are some of the contributing factors to the silent killer. And what were the results that you found? Did they surprise you?
Well, not surprisingly, load shedding is under the top 5. I think in South Africa that's quite relevant for us at the moment. You mentioned taxi drivers earlier. We're a very polite nation because people not saying thank you and please annoys us extremely, to the extent that it was under the top 5 annoyances that were identified. If we look at social media, and it's the order of the day, people who play on their phone or who's paying more attention to their cell phones or their mobile devices than speaking to you in a conversation. So all these kind of things, we love technology, but it is starting to interfere and annoy other people around us as well.
So how do you know that you're actually suffering a heart attack or a stroke? Is it a certain pain that you just feel and you know this is heart attack vibes?
You know, generally with a heart attack specifically, we talk about the left side, and you feel the numb feeling in your left arm.
Okay.
But it's so difficult to give signs and symptoms that we can relate to, because it depends on what type of stroke, for instance, you are experiencing. The important thing is, if you do have high blood pressure, make sure that you understand what the signs and symptoms are. Talk to your doctor. You can go to Pharma Dynamics website where we tell you what these signs and symptoms are, so that you are aware of them. And if you do start to experience those, it's important to react immediately.
And when you do react immediately, when you are suffering that attack, what should you be doing?
Very important. Get to an emergency unit or talk to your doctor as soon as possible. If you remotely think that you are suffering a heart attack or stroke, it's very important to get to healthcare very quickly, because they can treat you effectively to prevent damage or long-term damage to your organs.
Yeah, well, thank you very, very much for being with us and highlighting the importance of us knowing our health. So I guess going to get your numbers checked is very, very important as well. So if you're watching, so why not join us on social media? We want to know and find out from you what makes you see red. What are the things that really annoy you and make your blood boil, as we said? Is it work? Is it dirty dishes, perhaps? Is it taxes, like we said early on? So join the conversation. Expresso Morning Show, SABC3, that's where we are on Facebook, as well as Expresso Show on Twitter. Zoe, what are the things that make your blood boil?